Hi, my name is Katie Weeks, and I am a member of the Endowment Committee. The Endowment Committee is sponsoring 4 total seminars. One was last week. There's this week is on Medicare and Social Security, and then the next 2 weeks will be on senior living and options for senior stuff. So Leslie Madge is our speaker today. She is certified as a SHINE counselor, and she's assigned to the Acton, the Council on Aging. I love acronyms. She is credentialed as a certified elder law attorney. She's also credentialed as a super lawyer, which means that her peers have said, you know, she's really great. That's basically what super lawyer means, right? She just retired a few years ago as managing partner at the Madge and Johnson PC in Westford. And her practice concentration was in elder law, estate planning, estate and trust administration, income, estate, and gift tax. Leslie was also past president of the Massachusetts chapter on the National Academy of Elder Law Attorneys, and also she graduated from the New England School of Law as a jurist with a Juris Doctor. Thank you so much, Leslie, for coming and sharing your wisdom with us. We really appreciate it.
Well, thanks, Katie, for inviting me. So, as Katie mentioned, I've been an attorney my entire life, and I've been an attorney for the last 25 years of that. My focus was on all things estate planning with an emphasis on elder law. I worked with lots of families on protecting assets and doing all that sort of stuff. My partner still does that, but it was time for me to move on to do something else. So I have enjoyed being part of the SHINE program, and there's a lot to know, and what I have found is that there's a lot of misinformation out there. I live in Littleton, and up in the center of town forever, we've had a tarot reading spot, and recently they left. How they lasted all that time, I don't know. And it's been taken over by, there's a Medicare sign there that says, you know, come and talk to me about Medicare. But the problem with that is, and with all the ads on TV, they're really only focused on one side of the equation, and they're not telling you about the negatives, and they're not telling you about the alternatives. And so that's what we hope to do through the SHINE program. So SHINE is an acronym that stands for, I learned recently, serving the health insurance needs of everyone. So this is a program that began in the 80s, and it actually began in Massachusetts, and the rest of the country followed suit with their own SHINE-like program that they call SHIP, but we still call ours SHINE. And it's available through most senior centers. You can see any SHINE counselor. There's no charge. You don't have to go to the counselor in your community. You can go to, you don't have to be a resident. Okay. Thanks for the effort. You don't have to be a resident. You can go to any SHINE office that is convenient to you. So you can change the slide if you would. You can go ahead to, okay. So, no, it's not the one I thought it was. Wait, yeah, you can go ahead again. Okay, so as I'm saying, SHINE is there to help you with all things insurance, with a specific focus on Medicare, but we talk about some employer insurance, we talk about some COBRA, we talk about the Mass Health Connector, and we're trying to put it all together because it really is a very complicated subject. Okay, next. So I'm going to do a little bit of Medicare 101. We probably all have at least done some part of this, but as a refresher and to bring us up to speed, when you are first turning age 65, you will then be are given an option of a bunch of choices. And when you get into the world of Medicare, you're starting to talk about an alphabet soup. So we have Medicare A, Medicare B, Medicare C, and Medicare D, and we need to talk about what all of those things are. Okay, next. Next. Sorry. Enrollment periods. Why are we? I'm sorry, you did go so. All right, so I'll have you go back one if you would. Sorry. Okay, so for Medicare eligibility, back in the day when the world was, that one, back in the day when the world was new, everything occurred at age 65. So you turned 65, you were eligible for Social Security, you were eligible for Medicare. That's not true anymore. Social Security is disconnected now from Medicare, and we're going to talk about that a little later when we talk about Social Security. So unless you are already on Social Security, either because you took early Social Security sometime before your full retirement age, or you're on Social Security Disability Income, SSDI, when you turn 65, Medicare, Social Security does not know you have turned 65. So if you are already on the program, they know it. But if you're not on the program, they don't know it, and there's something you will have to do. Okay, next. So when you first turn 65, there is an initial enrollment period. And that initial enrollment period is a 7-month window, 3 months before the month of your birthday, the month of your birthday, and 3 months after the month of your birthday. And most people are going, well, a lot of people are going to enroll during that period of time. But sometimes you delay enrollment. And the biggest reason that you delay enrollment is because either you or your spouse have work-related health insurance that's your plan or the plan of your spouse. And that allows you to delay and come back to enroll at a later time. So the 7 months is your initial enrollment period. If you follow the little thing going to the right, every year there's a general enrollment period, which is the first 3 months of the year, and basically you use that if you've missed all the other windows, and hopefully you don't miss the other windows. There is a Medicare Advantage open enrollment period from January through March. We'll talk a little bit about that. There is a special enrollment period. This is the one that we use the most when you're past your initial enrollment period. And then we have open enrollment period, which is what we're coming up to right now while we're having this presentation. Every year from October 15 to December 7 is open enrollment period, where you have an opportunity to look at your drug plan and to look at your Medicare plan and see if you want to make any changes, and that would be effective as of the first of the year. Okay, next slide. So these are the enrollment periods, which I kind of already talked about. So go to the next slide, please. Enrolling in Medicare, if you think at 65, as I mentioned, you don't have to do anything to be in Medicare, that is not true. So even though this is Medicare, so you think you go enroll with Medicare, that's not true. You enroll through your Social Security. Can you still, all right. So you enroll through ssa.gov. So you all should have an account there. You have to give up your firstborn every time you want to log in. And on there will be a place to enroll in A and in B, and we'll talk about when you might do the one and when you might do the other. You can call Social Security, or you can do it in person, but why you'd want to, I don't know. Next slide. Okay, so as I said, sometimes for a lot of people, you're not going to enroll right away. If you are 65, you do have to do something, at least think about it. So if you are still working full-time and you have your own health insurance through work, group health employer plan, or you're on your spouse's employer plan, then you can delay enrolling in Part B. We're going to talk about the different parts in a minute. You may or may not have to enroll in Part A. You have to check with the employer. Part A of Medicare is mostly covering stuff in the hospital, and Part B covers everything else. So if you are in an employment situation where you are in an employer of less than 100 employees, they may require you, when you turn 65, to enroll in Part A, but they don't require you to enroll in Part B. Now, that's because up until now, they've been your sole insurer, And if they can get the government to take over some of that responsibility, they like that and want you to. If you're in a company that has over 100 employees, then they don't require that, and you can delay both A and B. For most people, there is no cost to enroll in Part A, and that's because you paid for it through your working years with your payroll dollars. If you do not have 40 quarters in, there are circumstances where you can purchase Part A, but that's for a small minority, and there would be information on that. So you could enroll in A, in which case you would get a card, and it would say your enrollment date for Part A only. As long as you're working on the employer plan, you are deemed to have creditable coverage, and that's important because when down the road, let's say you're retiring or you're coming off the plan because your spouse is retiring and they're not offering any retiree coverage, now you're going to have a special enrollment period. And the special enrollment period has two deadlines on it, one to enroll in B and the other to get a drug plan. So the special enrollment period will be an 8-month window. The enrollment for a separate freestanding drug plan is only 63 days. Why they're different, I don't know, but because of that, I recommend everyone think in terms of 2 months for everything. And really, you want it to be almost overlapping your last month because you don't want any gap. Just because you can take 8 months to enroll in A doesn't mean, in B doesn't mean you should, because if you have a health issue in the interim, well, you don't have any health insurance. That would not be a good thing. So I like to, if your health insurance through work is gonna end on October 31, you could technically have your insurance, your Part A and B start up November 1, but if you want to be super safe, you could have it start up in October 1 and have an overlap of a month just to be super sure that you don't have any loss of coverage. So if you don't enroll during the proper timeline, there is a penalty attached to your premium, and that is for life. And the penalty is attached to the Part B premium, and it's also attached to the drug premium. So this is why it's really important to enroll on a timely basis. And even if you're not taking any drugs, and there are some people that don't need drugs, but under those circumstances, they think they don't have to enroll, but you really do, because somewhere down the road, you might need drugs. And if you haven't enrolled in a drug plan during the time you were supposed to, then they will hit you with this lifetime penalty. Because, the government, we want to penalize you for not doing it earlier when we would have to pay more money. This is how the system works. So it's really important that you enroll in Parts B and D when it is appropriate to do so. Now, you're doing it after your initial enrollment period, which means you're over 65. So you want to avoid that penalty. The way you avoid it is you submit a form that is signed by your employer that shows that going backwards from when you're leaving their plan back to when you turn 65, government doesn't care what you were doing before that, the employer will say you had equivalent creditable coverage during that period of time, and that's what gets you out of having to pay the penalty. So next slide. Once you're into the world of Medicare, now you have to make some decisions. And so this decision tree here shows on the left what we call original Medicare, and on the right is the alternative, which is Medicare Advantage. So on TV all year, but especially at this time of the year, you are flooded with all these aging Z-list actors hawking Medicare plans. 99.9% of the plans that they're hawking are Medicare Advantage plans. They're walking across the tennis court and they're doing this, and that's all Medicare Advantage plans. And there is a place for those plans, but know that that's what they're selling. If you listen really carefully, once in a while, you'll see that the ad has the word supplement in it. If it says supplement, it's talking about the alternative, which is original Medicare. The biggest difference between original Medicare and Medicare Advantage is Medicare Advantage is not Medicare at all. Original Medicare, you sign up with the government, you've got your doctor, you've got your cards, you pay your premiums, you're covered throughout the entire United States, you don't have to have prior authorizations, and you don't have to have insurance oversight. In Medicare Advantage, you're going to give up some of that in order to have less premiums up front and more benefits built into the package. But there will be oversight. There is often prior authorizations. You have to have a primary care physician, which most of us do anyway. And you are limited in your network of where you're going to go. So if you're traveling, you're only covered outside your network for emergency services. And your idea of an emergency might very well not be their idea of an emergency. So if you travel a lot, Medicare Advantage might not be the right plan for you because you're going to be often out of your network. You also have to reside be physically in your network 6 months of the year. So if you're a Florida snowbird, you cannot stay longer than 6 months, running the risk all that time because you're out of the network. Because if you're there for longer than 6 months, you no longer qualify for that Advantage plan. Advantage plans are not with the government, they're with insurance companies of your choice. There's a list in Massachusetts. Everybody got mailed their handbook from Medicare this year. If you go to the back of that book, there is not what you download. I tried this morning. I went online to ssa.gov to my website to download their book, and I looked at it. That's the book that they give nationwide. There's a special one that they mailed to us in Massachusetts because at the end of it, there's a segment that gives you charts of the various plans that are available in Massachusetts so that you can, at a glance, compare and contrast, for example, the various Medicare Advantage plans. One of the biggest disadvantages that you don't see advertised on the TV commercials is the Advantage plans will often have deductible coinsurance amounts that you have to pay, not up front, but in the back door when you have to get services. For example, I had a client who was on an Advantage plan and she came in to see me because she was going to be doing hip replacement surgery, and her Advantage plan had a deductible of $5,700 that she had to pay towards that surgery. They don't advertise that on TV. That's one of the negatives that you never hear about. So even though it's attractive financially upfront, because your expenses are more upfront on original Medicare, you don't, with original Medicare, have these backdoor expenses that can be 4, even 5 figures per year that you would be responsible for. So Medicare Advantage is directly with insurers. It is a capitated system. What that means is the insurance company goes to Medicare and says, Mary Jane is signing up with us for her Medicare plan. Give us her dollars that you've allocated for the year to provide for her care. And Medicare does that. You have nothing to do with Medicare. All of your interaction is with your chosen insurance company. You go and you have your services for the year, and they pay out of that pot of money that they got from Medicare. If there's money left over, they get to keep it. That's why it's capitated, because they put it in their pocket and they don't get more. So if you needed more expensive care, they cannot go back to Medicare and say, oh, Mary needs something else, so we need more money. It's a capitated system, meaning that that's it for the year. This is why you hear the horror stories of people being kicked out quicker and sicker, because the Advantage plan isn't making any money on you if they're having to pay out this extra money. Okay, turn the next slide, please. So in original Medicare, I'll come back to Medicare Advantage. In original Medicare, you have to have Medicare A and B. This is where you go online to Social Security. You enroll in A if your employer requires it. You hold off on B because you've got employer insurance. When you are retiring or during your initial enrollment period, if you're not working, then you enroll in Medicare B as well. So you can enroll in A alone. You cannot enroll in B alone. If you're enrolling in B, you also have to enroll in A. A is hospital, B is everything else. So Let's talk about B for a minute. You've enrolled in B. Now let's say you go to the doctor. Now I'm making up numbers here. You go to the doctor and you have a visit, and the doctor submits his bill to Medicare for $600 for that office visit. Medicare looks at it and says, that's nice. We're not approving $600. We're going to approve $400. Of that $400, Medicare will pay 80%, or $320. You are responsible for the other 20%, or in my example, $80. This is why you get a supplement. So Medigap choices in Massachusetts are different from the rest of the country. The supplement in the rest of the country are these alphabet soup of plans, A, B, G, F, N. Massachusetts and 2 other states in the country got waivers to have their own plans. So we have very similar, but our rules are different and it's called different. We have 3 options for supplements in Massachusetts. We have Supplement 1, Supplement 1A, and Core. Supplement 1 is only available to people that were already 65 on January 1, 2020. And I am, and you don't want it, even if you are qualified, and I'll tell you why in a minute. So for most people, your choices are Supplement 1A or Core. Supplement 1A, there is a bunch of companies in Massachusetts. You'll see it in the back of that Massachusetts version of the Medicare handbook. We'll list all of the companies. The top company at the top, and the one we talk about, is Blue Cross Blue Shield, because everyone knows Blue Cross Blue Shield. They also happen to be the least amount of money. Why wouldn't you consider them? They all have to offer exactly the same benefits, so the only difference is what they're charging you. So a Blue Cross plan, for example, their Supplement 1A is also known as Sapphire Plan. That's a Blue Cross word. And it's $192 a month per person. Now, if you're on a Medicare Advantage plan, maybe you're paying $0 a month, and of course, we like that better. The alternative to Supplement 1A is a Core plan, and the Blue Cross Core plan is $116 a month. So you would decide which plan you want to get. They both cover, in the Medicare B world, largely the same. There are a few little differences. The big difference is in the hospital or the A world. Under Core, there is if you have to be hospitalized, you will pay a deductible of $1,600 towards that stay. And that is not per year, that is per stay, separated by a period of 60 days or more. So if you're in a car accident or you have a heart attack, you didn't plan these things, you end up in the hospital, you will pay the deductible of $1,600. You come home, you're home for a month, you have a complication, or worse, you have something entirely new happen to you, and you have to go back to the hospital. Because you're still within the 60 days, the original $1,600 still applies. After that, once you're outside 60 days, you're back to having to pay $1,600. The other way that you can end up in the hospital is with a planned procedure. So a planned procedure would be a hip replacement, for example. As long as you've got at least 30 days in front of you, if you're in Core, you can call up Blue Cross and say, hello, I'm in Core. I would like to change to Sapphire, please. And they will say, okay, as of the first of the next month, new premium, you're in Sapphire. There is continuous open enrollment in Massachusetts. So you go in, you're now in Sapphire, you have your surgery. Because you're in Sapphire, you do not have a $1,600 deductible. So you have your surgery, it's all good, you come home, you're good, you're not going back. You can call up Blue Cross and say, hello, I'm in Sapphire. I would like to switch to Core. And they'll say, okay, starting the first of the next month, we'll give you Core. So what you're doing, most people don't do this, by the way, but you could. What you're doing is you're playing a game. And you are assuming that you are not going to be hospitalized. And indeed, if you think about it, it's probably been decades since you've been officially hospitalized. It's hard to end up in the hospital these days. It can happen. You can have an unplanned procedure, and that will get you. But if you are willing to take that risk and willing to pay attention, you can do this and save yourself $80 a month. So if you were doing this, $80 a month saved by 12 months is $960, call that $1,000. Well, already there's $1,000 towards the $1,600 deductible you'd have to pay anyway. So your risk is actually $600. You have to come up with the whole 16 all at once, but really, if you're willing to think about it, you could do that. Most people don't want to do that, just saying. Okay, so you're going to choose a Medigap policy that's going to cover the 20% that when you went to the doctor, Medicare did not pay. What about that $200 that Medicare did not approve? Remember the doctor submitted the bill for $600 and they only approved it for $400? Are you responsible for the $200 as well as the $80? Well, you're really happy to live in Massachusetts because that's called balanced billing, and in Massachusetts that is not allowed. So if your provider is in the Medicare program, which almost all of them are, they have agreed to accept the Medicare billing rate as their full compensation. So you're only responsible for the 20%. Nobody pays the overage above that. Beyond the Medicare B, which you pay a premium for, and the supplement, which you pay a premium for, you also need a drug plan. And that is usually the focus of open enrollment, and we'll talk about that. The premium for Medicare B is this year set by Congress, and the base premium is $164.90 per person. That is set by Congress every year, and they look at your income from your tax return 2 years prior to determine where you are in the slate. Don't do what I did. At 63, I decided to buy a condo. And I decided instead of getting a mortgage, I was going to take money out of my retirement account and pay for it in full. I figured out all the taxes, I was all good, and I did it. And then 2 years roll around and I apply for Medicare. Well, they're looking at my tax return from 2 years before, which was really high for 1 year because of the money I pulled out. I got to pay the maximum of over $600 a month for a year. How happy was I? But then the next year, it all clicked around for another year, so then I fell back down. But it can be a really unpleasant surprise. If you're taking a lump sum out of a taxable, something that's going to hit your tax return, or you have a capital gains on the sale of something that's hitting your tax return, these are usually once in a while events, and you don't really think of them as part of your taxable income, but Medicare does. So you can be unpleasantly surprised, as I was, and I should have known better, by virtue of it's affecting your premium. And if you're filing a joint return, it'll affect both of your premiums because you file a joint return, but it's only for 1 year. Because then the next year, they click back to the next tax return 2 years prior, which is now a different tax return. So you've got the base premium of $164.90 that you're paying for your Medicare Part B. You've got your supplement, we'll assume it's with Blue Cross, just so I can give you numbers. And if you've chosen Sapphire, Supplement 1A, you're paying $192 a month. And you also need a drug plan. And the drug plan, I can't guesstimate for you what it will be because it's a function of what medications you're taking and what pharmacy you go to. But you need all those things. So it's a number. And you're looking at Medicare Advantage and you're not paying anything up front. So why wouldn't we go with Medicare Advantage? And the reasons are Medicare Advantage is best suited to someone who does not have a lot of medical issues and does not travel. Because every time you travel, you are out of your network, and that runs the risk that you're going to have out-of-network expenses that you'll have to cover yourself. As you have medical expenses, there will be backdoor co-insurance deductibles that you will have to pay that, as I say, could rise to 4 figures. And if you look in your Medicare handbook in the back, it will show you what your maximum out-of-pocket expense for a year could be, and you'll see that they're almost all 4 figures. So it's a real number if you end up having a medical event. The original Medicare, you pay numbers up front. That's it. You'll pay a $10 copay here or a drug copay there, but you're not paying unexpected big numbers, and you're not dealing with prior authorizations, and you don't have to worry about traveling because it's covered throughout the entire United States. So these are the things you have to weigh on whether or not which way you want to go. And if you decide to go in one direction, every year during open enrollment, you have an opportunity to make a change. So if you will go to the next slide. So open enrollment happens every year. It has to happen at least once a year. And it's from October 15 to December 7. And whatever changes you make will be effective on January 1. So we're coming up on that time now. Most people absolutely should use it to review your drug plan. Because even if you're happy with your drug plan, that doesn't mean that the drug plan will be right for you the next year. They can and do change their formularies and their pricings all the time, and you may well find that it's not going to meet your needs the next year. You can also use this opportunity to decide if you want to stay with your Medicare Advantage plan or switch to another Advantage plan or to Original Medicare. Or if you're on Original Medicare, do you want to switch to an Advantage plan? These are the times that you do all this. Next slide. Open enrollment is important because things change year to year. Formularies change year to year, and this is the time to review it. So even if you're, let's say, on either Original Medicare or Medicare Advantage, and you like your plan and you're good with that, you want to check the drug side of it. On Medicare Advantage, those plans, with rare exception that you don't want, include drugs. So you want to make sure that the drug portion of your plan is going to include the things that you think you're going to need next year and not change it, in which case you might need to make a change. If you're on Original Medicare, then you want to check your drug plan to see if it's still going to be the right fit for you. Going next page. So to check on your drug plan, you go to Medicare.gov. And the landing page for Medicare.gov is what we call a plan finder. And that's where you can either just go in quick and dirty as a guest, put in your medications, they'll give you a list, but they don't save anything. The better thing to do is to make an account and put in your medications. It will save it there. And then when it gives you a list, it will begin by putting up what your current plan is. That doesn't mean it's the plan it recommends for you. It's just putting up first what your current plan is. And then it will list in monetary order what the next plan options are for you. And the numbers that they give you are a combination of monthly premium and out-of-pocket expenses for the year based upon the drugs you put in and the pharmacies you selected. So you always want to select more than the pharmacy you regularly use because you want some comparison. And you will find that the drug companies' relationships with different pharmacies will result in different pricings. So just because it's X dollars at CVS doesn't mean it won't be Y dollars at Walgreens, for example. And you want to know that in making a decision. You do this at Medicare.gov, and it's better to create an account. This is something that the Shine counselors work with people during open enrollment. Lots of people want to come in and do it with the Shine counselor, and that's fine. We do that. But most people forget to bring in their enrollment credentials. So they don't know what their login is, and they don't know what their password is, and it makes it really hard to help them because we can't get online. So if you're going to do that, please remember to bring in your login credentials so we can work with you. Okay, next slide. The Plan Finder is on Medicare.gov. So after you've enrolled in Medicare through socialsecurity.gov, you then deal with your plan on Medicare.gov. Again, only the government could make it this hard. Next slide. Medicare Advantage is the alternative to Original Medicare. And as I say, that is where it's more all-in-one. It includes everything. There are HMO networks, and then there are bigger PPO networks. But they're all networks. PPO might be bigger, but it's still a network. So unless you are in the network, you could end up with bigger out-of-pocket costs that are not listed on the chart because you're paying 100% of it because it's out of network. And you won't always know if it's out of network. Even if you're at your local hospital, you could be dealing with an anesthesiologist that's not in your network. And these are unpleasant surprises that you only find out after the fact when it's too late Not that you're going to negotiate with the anesthesiologist as you're rolling down the hall, but that is the problem. Open enrollment for Medicare Advantage plans. In addition to October 15 to December 7, there is a second enrollment period, kind of like a do-over. From January 1 to March 31, if you're in an Advantage plan and you want to change it, you made a mistake, they give you a do-over. A second open enrollment period for the first 3 months of the year, only for Advantage plans, and you have to be in an Advantage plan to take advantage of that. Next slide. So for Part C, which is Advantage plans, and Part D, which is drug plans, standalone, used on the original Medicare side, there are also things called special enrollment periods, which is outside this window that we've been talking about, where you can do things, but you have to have a qualifying event that will allow you to have a special enrollment period. So if you are in an Advantage plan, and let's say you're based in Worcester, and you move to Stowe, which is not in Worcester, well, that a change out of the area where your network is opens a special enrollment period that allows you to change plans, because now you're permanently out of network and you want to be able to be in network. So that's why they give you a special enrollment period. To change your drug plans, one of the most common questions I get is, if partway through the year I get prescribed with some drug that I've never had before, and of course it's very expensive and is not in my drug plan's formulary, does that give me a special enrollment period to change drug plans? And the answer is sadly no. So under those circumstances, you would see if your doctor can prescribe an equivalent generic, or if there is no generic, can he prescribe some other medication that is in your company's formulary? Or you can call up your insurance and beg and plead, will they give you an exception to cover it through the end of the year? In theory, they will. I haven't seen it yet. Or you use one of those like Good RX cards where you're paying for it privately, not through your insurance, but you get a discount with these cards. And you tough it out to the end of the year when you have open enrollment, and then you can change. There is one other exception. Find my paper here, I made a note about it. Okay, there is some plans, some programs in Massachusetts to help people with various things, especially drug plans. Most of them I'm not going to mention, because most of them, in addition to having income limitations, have asset limitations. And for many, many people in our area, we would exceed the asset limitations. You're allowed to have a car, you're allowed to have a house. Some limits, but for most part, it's a house. Beyond that, you're allowed to have modest amounts of money, like as a couple, under $20,000. For most of us, if you take bank account monies and retirement account monies, you're going to be over that number. So for most of us, the asset limits are the problem. There is one program in Massachusetts called Prescription Advantage. There are no asset limits, and the income limits are pretty high. There are 5 levels, and the highest level takes you up to, if you're a single person, you can have income of $72,900 for the year. And if you're a couple, your income can be $98,600 for the year. That covers a lot of people. So sometimes, if you need to change your drug plan, the purpose of Prescription Advantage is to help people with their prescription drug costs, and that's great. But there's another advantage here that you really don't think about. Sometimes if you need to change your drug plan and you've exhausted all opportunities and there aren't any, there is a way to get a special enrollment period, which is to enroll in Prescription Advantage if you meet the income limits. Even if you don't need help with your drugs, it's worth doing, because enrolling in Prescription Advantage opens a special enrollment period, which allows you to change your drug plan. And sometimes we have wanted to do that because it's the only way we can solve our problem, other than limping it through to the end of the year, which we're trying not to do. So I've done that for a couple of people where we were okay handling our drugs. I forget what the reason was we needed to change drug plans, but it wasn't that. But we enrolled in Prescription Advantage anyway, even though we weren't planning to use the drug savings component of it, because we wanted the open enrollment piece so that we could switch our drug plan. So there is a little bit that you can do, and this is where your Shine counselors can help you, because that's what they're trying to be aware of, is all these different little things that you could do. Okay, next slide. This is some of the overview of what Biden's Inflation Reduction Act has changed. A couple of big things is insulin costs are now capped at $35 a month, and that includes insulin by pumps, which are usually covered under Medicare A and not Medicare B. Initially, they made a distinction between that, but it's all now limited to $35 a month. And the other big thing is that in the future, premium increases for Part D, that's drugs, not B for Medicare, are going to be limited to cost of living not more than 6% a year. Next slide. So I mentioned a little bit that there are some Massachusetts programs that will help with some Medicare and prescription drug costs. Mass Health is your basic Medicaid, but again, it has, in addition to income limits, it has asset limits. There's a program called Medicare Savings Program, asset limits. There's a thing called Extra Help. You get that through the Social Security site, but the Extra Help also has asset limits. And the asset limits are going to be next year $16,000 for a person and $33,000 for a couple. So a little bit better, but for most of us, we're going to be over those asset limits, not accounting the car, not including the house, but still bank accounts, retirement plans, stock portfolios, you're going to be over the number. So there is some stuff that helps us. That Prescription Advantage plan is the one that I have found the most helpful, because it has very high income limits and no asset limits, and it gives us an opportunity to change our drug plan if we need to do so. And then there are those good RX cards and things like that that you can download and use privately. Next slide. This is for the Extra Help, which is only if you qualify. I'm going to skip that. Next slide. If you are getting your health insurance prior to being on Medicare through the Health Connector, you know how we have mandatory health insurance in Massachusetts. So you personally or your employer-related insurance might be through the Health Connector. Unless you are on an employer's group plan, which you're still allowed to be on, if you're on the Health Connector yourself, once you turn 65, you're no longer eligible to be on the Health Connector because they want you on Medicare. So you need to be aware of that and taking steps so that you don't have a gap and you don't have a late enrollment. Next slide. Really, don't miss the deadlines. That's what the slide is all about. And then on the last slide, places to go for help. And that's everything I have to say about Medicare before I talk about Social Security. Or do we want to go right into Social Security and then?
Let's take questions now for Medicare that's online.
Let me go through Social Security. I have some to say. I didn't know if there was a whole lot to say, but let's do that, and then we can talk about anything you want. So Social Security, I was asked to touch on Social Security as well. So next slide. Back in the day when the world was new, Social Security full retirement age was 65. But if your date of birth is if your date of birth is before 1943, so 0 to 1942, your full retirement age is 65. If you're born between 1943 and 1954, your full retirement age is 66. Now, you can claim Social Security benefits as early as age 62 or as late as age 70 or anywhere in between. At under full retirement age, which right now is age 66 on this slide, if you're going to claim Social Security benefits early, you are subject to an income limitation. And if your income is higher, they will offset $1 of Social Security benefit for every $2 of earnings that you have. The limitation this year is $21,240, except the year that you're going to turn full retirement age. On that year, the income limit prior to the month you turn full retirement age is actually $56,520. So usually it's a lower number, but that last year you get a higher number that sometimes you can work with. But still, there is an income limitation, and for many people, that's enough reason to delay collecting Social Security early. If you are going to collect it early and you're either not bothered by the income limitation or it doesn't apply to you, the earliest date you can apply, with rare exception, is age 62, and you're going to get a 75% amount forever. So if we use a standard benefit of $1,000 at full retirement age, that means by signing up at age 62, you're accepting a benefit of $750 forever. You won't ever go up to the $1,000. So as you creep along up to full retirement age, they will add amounts until we get to full retirement age, which here is age 66. Then you would get the full $1,000, and now there is no longer an earnings limit. So you can still be working, you can make $1 trillion, and you still get your full 100% Social Security check. If you choose to delay it further, which you can up to age 70, then it will incrementally increase to a maximum of 132%, which in my example would be a $1,000 check that is now $1,320. There's no point in delaying beyond that because it doesn't increase more than that. Next slide. If you were born between 1955 and 1960, your full retirement age is something else. And it incrementally is higher until you get to 1960 birth date, when the full retirement age maxes out at age 67. You can also see that the incremental amounts, if you go to 1960 or later, if you start at 62, instead of getting 75%, you're only getting 70%. And if you wait until age 70, instead of getting 132%, you're only going to get 124%. So as they're increasing the retirement age, you're also seeing this change in the incremental choices that you can make. Next slide. So to find out what your benefit is, every year they do a benefit calculation. They used to mail it to all of us. Maybe they still do. I haven't seen one in a long time. You go online to your account at Social Security, give up your firstborn, and you will get a record of your earnings, except once you're receiving Social Security, you don't get that record anymore. I didn't believe it, but it's true. So you should be hanging on to your earnings record. My husband passed away in 2005, and I kept his earnings record, and I scanned it. The greatest invention is scanning, let me tell you. And he had been gone for a long time. I couldn't look up his record anymore. Well, because he's gone and it's not on my record. But when I turned full retirement age, I was able to claim survivor benefits, and I had an idea as to what the survivor benefit would be because I had his old record. And I couldn't get it any other way. So you really want to hang on to those records, not just in the site, in the computer, because it will go away. You want to download it and keep it yourself for your future reference. You will get, for a benefit, either your own benefit or a spousal benefit, which is one half of the other guy's, whichever is greater. In order to claim the spousal benefit, they changed all these rules a few years ago. Your spouse has to be claiming two. So you can't claim, if you're the older person, you can't claim for the spousal benefit until the younger person is also filing. In that circumstance, you would get your own benefit, which is lower, in my example. Then your younger spouse comes along, is now claiming. Now they will increase, if the spousal benefit would be more, they will give you yours plus enough, topping it up, to get you to the half number, so that you in effect get the half, but not until your spouse is actually filing. All right, next slide. So some circumstances, if you're widowed, it's not a 50% benefit, you'll get 100% benefit. And this one here, you can delay your own benefit. Under the spousal rules, you're both alive. You used to be able to play that game, and you can't do it anymore. You have to have been born before 1954, which is a decreasing number of people, to be able to play that benefit. So for almost everyone now, if you're both alive, you both have to be filing in order to do anything. But that's not true with the widowed benefit. You can, at your full retirement age, take the survivor benefit. Spousal benefit is 50%. Survivor benefit is 100%. And you can take that and let your own delay until you're 70, and that's what I did. So when I turned 70, sadly, that was a year ago today. Today's my birthday. Oh, thank you. It's hard to get excited at this stage, but there you are. I guess it's better than the alternative, right? So you can take, and for many people, this makes a whole lot of sense because you're leaving money on the table. You're letting your own grow, even if it's only to the pitiful 124% instead of 132%, if your full retirement age is, you're in that category. You're still allowing it to grow and still getting some benefit by virtue of taking the survivor benefit. There are also family benefits, which I have not addressed here. You have to have children under age 16, or they have to be disabled in order to continue to receive something for them. If you are widowed, you are allowed to continue to receive the benefit in remarriage, but only if you remarry after age 60. So if you remarry before then, you're going to lose the Social Security benefit. If you remarry after then, you get to continue to receive it. Now, if your new spouse is now retiring, you don't get to double dip. So you'd give up one or the other, and you'd keep whichever one is the higher, obviously. You don't get to keep both. Next slide. So if you're divorced, here's the big takeaway. If you're in a miserable marriage, stick it out for 10 years. Because if you've been married for 10 years, then you're going to be, I was reading something online, just freshening up for today's thing, and it gave the example of Johnny Carson, who apparently was married 4 times. Wife number 2, they were only married for 9 years. She didn't get any survivor's benefits because she didn't make the 10-year rule. So hang in there if you can do that. So if you've been married for 10 years, then you will be eligible for a spousal benefit based upon the record of your ex-spouse. That's assuming that their record is worth more than yours. You have to have been divorced for at least 2 years. Now, I dug into this because I didn't understand that rule. It turns out that really only applies if you are applying before your full retirement age. Then you have to have been divorced for 2 years. You will get the greater of your own benefit or the half spousal benefit, and if you're under full retirement age, it will be permanently reduced according to that chart that I mentioned to you. So you don't here get to claim the spousal benefit and defer your own. That's only available to survivor benefits now. A spousal benefit, either because your spouse is alive or your ex-spouse, you're only able to claim the higher of the spousal benefit or your own benefit. You don't get to pick and choose. However, you do not have to wait for the ex to have filed for his own benefit. You can claim your own starting at 62, accepting the lower amount or waiting to age full retirement age, and it's not dependent upon when the ex is filing. Next slide. Now, there are a lot of people who are getting both Social Security and government pensions. And there is a thing called a windfall elimination provision. So let's say you're a teacher, or as my husband was, a police officer, and you have a gig on the side. So you've got credits into the Social Security system as well. And now you're retiring, and you're getting your teacher's pension, and you're also eligible for Social Security based upon the years that you worked in the private sector. Your Social Security pension is considered, your Social Security benefit is considered double dipping with your government pension, and they will reduce the amount of your Social Security benefit by an amount that I haven't tried to formalize, but your Social Security benefit is reduced by an amount because you're receiving the government pension as well. That's called the windfall elimination provision. So, and they talk about getting rid of it every year, but it never happens. There is another one called the government pension offset, and this is in a death situation. So if John and Mary, my favorite examples, John dies first. He has Social Security from the private sector. Mary was the teacher. His Social Security could come to Mary as survivor benefit, 100% of his Social Security, but because Mary, the survivor, is receiving a government pension, so she's getting Social Security not on her own record, but on the record of her deceased spouse or ex-spouse, this triggers the government pension offset provision, which again reduces the amount of the Social Security benefit coming to the surviving spouse who gets the pension. There is an alternative arrangement, and I never find the answer, and I've searched and searched for years, but I'm 100% confident of my answer, even though I can't find anything that exactly says it. It says it in the alternative. If the survivor is John, the one who was in the private sector, and Mary, the teacher, when she retired, chose option C, joint and survivor. So now John is getting a survivor government pension. Because the government pension is not on his work record, his Social Security is not reduced. So he gets the government pension at 2/3, and he gets his full Social Security. Because he's not claiming Social Security on his spouse's record, he's getting the pension under option C. So you won't find that anywhere. The closest you find it is it talks about the government pension on your own work record. And I've researched this to death. It is me. Mine is not reduced, so I'm confident that this is true. You never see it. But the surviving spouse could be the one who was not earning the government pension, but is the survivor under the option C option. Next slide. Okay, and then, so as a summary, Social Security and Medicare, you're going to apply for Social Security yourself between age 62 and 70. If you have not applied before full retirement age, Medicare does not know it. Social Security does not know it. You have to do something to make it happen. So if your employer is saying, yes, you can still be on the employer plan, but you have to sign up for Medicare A, you have to go and do that. It doesn't happen automatically. If you are retiring or you're coming off of your spouse's plan and you're in your initial enrollment period, it's not happening automatically. You have to do it yourself. And you do it online at the ssa.gov website. Your Social Security benefit, whatever amount it is taxable federally, either at 50% or 85%, depending upon your income on your tax return, but it is not taxable to Massachusetts. You need to apply for Medicare at age 65, regardless of whether you are deferring your Social Security. You also do this at the ssa.gov website. Thereafter, you manage it at the Medicare.gov website. The premium for the Medicare, which the Part A premium is $0, the Part B premium is $164.90 and up. That is deducted from your Social Security check, unless you don't get one, in which case they bill you quarterly for it. So it's not every month, it's quarterly. Once you're receiving Social Security, they don't give you that option anymore. They just deduct it from your benefit. And that's it. So that's everything I have to say on the subject of Social Security and Medicare, and I'm happy to answer any questions. Yes.
So currently, I am using the national system, and I go a month for health insurance. When I sign up Medicare, or something.
So the question is the interaction of Mass Health with Medicare. When you're under age 65, you can qualify for Mass Health based upon income, and there is no asset test. Once you are 65, there is an asset test as well, and for most people, they don't meet it because the asset test is laughably low. If you are on the Health Connector, because I'm not quite sure which question you're asking me, if you're on the Health Connector, that's not Mass Health, and once you're 65, you're not eligible to be on the Health Connector unless it happens to be your group employer insurance plan. If you are on Mass Health, and you're over 65, you're reaching 65, they're going to send you a new application. You have to reapply because now they care about your assets. And for most people, you'll be over asset and you won't qualify. So that's when you have to look at some of the other programs. Maybe the asset limit for a couple is $3,000 for Mass Health. So, that's nothing. So if you have modest assets, let's say you rent and you have $10,000 in a bank account, you might qualify for some of the other programs that we didn't talk about today that will help you with some of the payments on the Medicare premiums that otherwise you're going to have to deal with. So I would encourage you to meet with a Shine counselor and bring in your income, and they can go over with you what benefits you might be eligible for. Yes, sir.
Your next to last slide, if you turn about the double dipping.
Yes.
I hope that does not apply to private pensions.
The question is, does the double dipping apply to private pensions? And the answer is no. The key is whether or not the pension contributed to Social Security. And government pensions, in some states they have, but not in Massachusetts. So that's why there's a handful of states throughout the country with Massachusetts trying to deal with this government pension offset thing. Private pensions are always still part of the Social Security system, and that's why there's no offset there. So you qualify for the private pension and you qualify for your Social Security.
Yes. For some reason, it's still stuck on the penalties for not signing up for Medicare and which one is okay not to sign up for and which one you must.
So Medicare, when you sign it up and what the penalties are, that's a great question, and it's very confusing. You have to first start with, are you working, or are you on your spouse's working plan? If you are working, generally speaking, you can delay signing up for B.
Just B.
Whether or not you can delay signing up for A, you have to check with the HR department at your company. They may require you to sign up for A. It's usually not painful because you're not going to pay a premium for it because you've got enough credits into the system.
What the hose?
When you are ready to be on B, which you would not do while you're on a group plan, but when you're leaving the group plan and now you're over 65, you have to show evidence of creditable coverage going back to 65 to avoid the lifetime penalty, and that's where HR fills out this form that you give them. I think it's form L564, I think is the form, in the bottom lower left corner of the form. You'll find it online at the Social Security's website, and you can download it. And when you're getting ready to retire or come off the plan, you give it to HR. If there's a husband and a wife, you need 2 forms, one for each of you. Okay?
First use one duties and shadow it runs outfit.
That's correct. You would not do B. You need to check with whether they want you to sign up for A. All right? Yes, ma'am.
So I'm 63 now, but I'm 64. But I know I'm asking Mass Health to make it because I'm semi-retired now.
Yep.
So my birthday's November the 12th, but my premium's due the 1st for the health connector. I'm going to have 12 days. How is that handled? Do I need to pay for a month for the health connector? I'm just thinking in advance.
For a year from now. Well, you're going to want some overlap so you don't have a gap. So you will want to make sure that your Medicare coverage is going to start the 1st of November, even though your birthday is not until, well, let me say this. You sign up for it effective the 1st of November. They won't actually start it until your birthday, and that's why you want an overlap so that you don't have a gap.
They won't cancel it because serious need is that's the Mass Health that they will cancel it. They don't cancel it that the concept here.
The cancellation won't happen until you have switched over to Medicare. That's right.
Right? And none of these.
Yes, sir.
So on the Medicare Advantage now, what's the decision tree, or what you consider going to a regional?
So the things that really bother me about Medicare Advantage are you need prior authorizations and you're out of network every time you travel. Some hospitals, not in Massachusetts, but I read earlier this year that the Mayo Clinic, everyone knows the Mayo Clinic, had announced this year that henceforth they were no longer going to participate in any Medicare Advantage plans. I will not be surprised if that's not the beginning of a trend because of all the red tape and the prior authorization stuff, and they just don't want to deal. But the biggest issues are, if your doctor wants you to have X, the insurance company is going to review that and decide if you can really have X. Or if they want to put you on some therapy, the insurance company may take a step therapy approach and say, well, you can't do that until you've tried these other two things first. That does not happen in the world of original Medicare. If you travel at all, if your grandchildren are out of state and you visit them with any regularity, or you're going to be out of state regularly and often, an Advantage plan is a real risk because you are always out of the network when that happens. So that's, in my view, where you would have to think about that. And then there's the backdoor four-figure co-insurance amounts that you'd have to pony up, which is the price you pay for having smaller upfront expenses. Yes, sir. Yes.
I just wanted to support what you just said about the in-network and out-of-network. We didn't realize many years ago when I remember the insurance is one of the two, I think there's cases in Granby, I think the politics, maybe when it's trying to
Yeah.
figure that out.
Yeah.
We went to Florida and we had a humongous.
Yep. It can be a real problem. And the other thing I'll mention to you is another really good perk of living in Massachusetts. If you're switching around, if you're on Medicare Advantage for a while and it's worked for you, but now things are changing and you're going to appropriately make a switch to original Medicare, it's long after your initial enrollment period or a couple of years ago, it doesn't matter. In other states, well, all across the country, on your initial enrollment period, if you do an original plan and you need a supplement, the word supplement always means an original plan, not Medicare Advantage. You get your supplement, they have to take you if you pick them, even if you have pre-existing conditions, because you're in your original enrollment period. In other parts of the country, not here, if you're going on to a supplement after your initial enrollment period, so you started out in Medicare Advantage, it was working for you, but now it's time to change because you've got something going on, and you can switch to original Medicare just fine. The problem is now you need a supplement, and because you are outside of your original enrollment period, they can medically underwrite you and not take you. Well, you want them. And in Massachusetts, there is a guaranteed issue, which means that they cannot refuse to take you because of medical underwriting. That's a big advantage that we have here that is not available in most other jurisdictions. Yeah. Yes?
Is there travel health insurance though?
Travel health insurance? So there is. I don't know anything about it, except that if you're in a Medicare Advantage plan, you'll want to deal with that and get something. I can't think it's going to be less expensive than having been in original Medicare in the first place. If you're traveling internationally, you won't be covered either under Medicare, original Medicare or Medicare Advantage. In the world of original Medicare, the only exception to that is if you're going to Alaska, you have to cross Canada. They will cover you if you're going direct from A to B. If you wander off the path and spend a day sightseeing, they won't cover you. So you would have to prove that you're going directly there. But except for limited things like that, Medicare is only covered in the US and Medicare Advantage is only covered in the network. And if you're outside of those areas, you need a medical rider that you would have to research to get. Yes?
Do other industrial countries have such a complicated process?
I don't think so. We like to go our own way. But, I read about things like at the UK, it's hard to believe that having to wait forever and the ambulance takes hours to come to the side of the road when you fell and broke your hip, that doesn't sound like a good plan either. So it's hard to know what's better, but it's the devil we've got, and we're tied to work-related insurance. That's never going to change either. So we just have to work with what we've got. But because of the complexity, this is why SHINE, coupled with area communities, is trying to get some information out there. You can work with insurance people, like the sign in Littleton Center that used to be the tarot reading place, and now it says Medicare. But they're mostly just going to tell you about Medicare Advantage. And why is that? Because they get paid more. So the SHINE program is great because it's trying to give you, well, there's no charge for it, and it's trying to give you more independent, neutral information so you can make your own evaluation as to what's the right fit for you. Well, I want to thank you all. You've been very patient. You've had great questions, and I hope I've helped answer some questions. And go check your drugs during open enrollment. Thank you.